Hello, I'm Sophie Harper, lead assessor at the College of Optometrists, and I want to welcome you to stage one of the scheme for registration. So I'm now going to give you an overview of the scheme and let you know what to expect in your up and coming assessments and what you need to do to prepare for them. None of this news should be new to you. It's all available in the Scheme for Registration Handbook, which is on the college website. And for those of you who are working in multiples or practices where they've had a trainee previously, your supervisor will be familiar with a lot of this information. The information in this presentation, however, is very important, and the aim of the presentation is to make sure that all trainees get the same information. The other thing to note is because of the COVID pandemic, that has forced us to make some changes to the scheme. Use this as your reference point for the most up-to-date information. You cannot rely on how the scheme has run in the past. So I'm going to start with the scheme for registration timeline. It'll seem a long time ago now, but once upon a time you were all in the third year at university, and we did try and visit all the universities to talk about the scheme for registration. And you can see that the scheme is set into three different stages: stage one, stage two, and the OSCEs. Now, most trainees will need 4 visits for stage one. Visit 1 takes place about 6 weeks after you've enrolled on the scheme, and that will be a remote visit. Visit 2 takes place about 4 months after you've enrolled on the scheme, and there we are covering 33 further elements of competencies, and again, this is a remote visit. Visit 3 is 6 months after you've enrolled, and this will be a face-to-face visit. You may well need a visit 4. About 83% of trainees complete the scheme in 4 visits, and that will be remote or face-to-face, depending on the requirements that you have to complete stage 1. Once you finish stage 1, you move on to stage 2, and this is normally 6 weeks after you've finished your stage 1. Stage 2 is split into 2 elements. There's the overarching element, and then the direct observation by a different assessor of a routine eye examination and a contact lens examination. Once you've passed stage 2, you move through to the OSCEs, and this is usually at about a year after you've started on the scheme. Now, it's very important to consider the scheme for registration as a whole. You'll start with your stage 1, and then once you've finished stage 1, you'll be signed off and move into stage 2, which takes place about 6 weeks after you've been signed off for stage 1. And then your OSCEs are planned 6 weeks after you've completed your stage 2. We've got OSCEs running in January 2021, and the College of Optometrists website is regularly updated with the further dates, but there will be deadlines. So I would encourage you not to cancel any assessment visits, because if you do so, this will push back your stage 2 and then ultimately your OSCEs. Your stage 1 assessor will regularly review your progress to ensure that you're realistic about when you can sit your OSCEs. Now, what's new this year? So the first thing is that the Scheme for Registration logbook has changed, and this is available online. You should log your patient encounters and also the characteristics. So a characteristic may be that you've seen a patient with a cataract, or that you've seen a pediatric patient, or you've seen a soft contact lens aftercare. So all this should be monitored in your logbook, and you are no longer able to use paper logbooks. Also new in the scheme this year is that it's a mixture of both remote and face-to-face assessments in stage 1. So as I mentioned previously, visit 1 and visit 2 are remote, visit 3 is face-to-face, and visit 4 could be either. There is now a virtual HES placement option. All trainees within the scheme for registration need to complete a hospital placement. There is a new supervision policy in place. So you will all have a principal supervisor who needs to have at least 2 years post-registration experience, have completed the Introduction to Supervision course, and be a member of the college. Your principal supervisor can then authorize additional supervisors who also all need to have at least 2 years of experience and be members of the college. The new supervision policy is a fantastic opportunity because you can also now use the expertise of dispensing opticians or contact lens DOs that are in your practice. And as long as your principal supervisor has authorized them, then they can also supervise you once you're in practice. We're using new forms of evidence. We're using anonymized patient records and trainee case discussions. And stage 2 is split into 2 sections: the overarching section, which is carried out remotely, and the direct observation of the eye examination and the contact lens aftercare and fit. So quite a lot has changed from previous years. Now, when you are on the scheme for registration, you need to understand competence. You need to get your head around the idea that the scheme is assessing your competence. So not just do you know something, whether you have the knowledge, not just can you do something, whether you have the skills, but whether you can use that knowledge and skills appropriately wherever you need to with real patients, and you can prove it. So this is really quite difficult from how you were assessed at university, and will require a change in how you think and prepare. Lots of the evidence you present is required to be record card based. And what this means is that it is no use getting to 2 weeks before your assessment and cramming like crazy, because the record cards from the previous 3 months won't show the knowledge and skills that you need. It means that you need to use your knowledge and skills consistently, because you might show your assessor an exemplary record of dilation, where you did all the checks beforehand, you measured the angles, you carried out the dilation, and then you checked the pressure afterwards. But the assessor may then choose a different record from your logbook where you carried out a dilation and you've got many of those key points missing. So therefore, you're not demonstrating consistency. So the idea of assessing competence is to make you develop good habits and practices now that you'll retain for the rest of your career, rather than just doing something for the exam and then forgetting it immediately. So besides direct observation and patient records, there are many other forms of evidence that are used for you to be able to demonstrate competence. Your assessor might show you images of ocular conditions and ask you how to manage them. They may give you a prescription of, say, a high myope and ask you what's missing. Maybe it's the back vertex distance. They'll ask you knowledge-seeking questions. We also are now using anonymized patient records. Now, this will be a record of a patient that you have seen in practice. You have to remove all the identifying features apart from the patient number. So you'll have to remove the patient's name, their address, their date of birth, their GP details, and then you have to hold them up to the screen electronically so that you can share them with your assessor as part of the assessment. The anonymized patient records are not sent to the assessor before the assessment, but before each assessment, you will need to show these to your supervisor so that they can check them and certify them that they have been fully anonymized and are a genuine representation of the original record. What your assessor is looking for is for you to present a scan or a photograph of the original record with the identifying details removed, not a rewrite of the record. Another new form of evidence is a trainee case discussion. And these are case discussions based on records of real patient encounters which you will present to your assessor in a structured format. They are designed to give a clear indication of your thought process and actions. And again, these are not shared with the assessor before the day. Witness testimonies are being used to demonstrate competence. And we'll come back to this. Your logbook can also be used because in your logbook, you have a list of all the different patient encounters that you are required to gain during your time on the scheme for registration. So it would be very good practice to keep filling in that patient encounter list as you go along. And reflective accounts. Some of you will be used to reflective accounts from university. We're aware, others of you are not. But reflective accounts are a structured way of reflecting on your experiences of specific real situations and presenting your learnings from these situations to your assessor. A reflective account should be sent to your assessor ahead of the assessment visit. So we have said that the assessment process is competence-based and your success will depend on the evidence you present. As a result of this, the assessment process is very individual. It will be based on the evidence that you present or the patient that you provided for the direct observation competencies at visit 3. And as a result of this, the assessment process will be very individual. It will be based on the evidence you present. And as your evidence and your patients will be different from the trainee down the road, your assessment will be different. Importantly, though, you'll be assessed to the same standard as your peers. Let's have a look at that in a little bit more detail. If we take the competency 618, the ability to evaluate glaucoma risk factors, detect glaucoma and refer accordingly. Now, the compulsory evidence for this competency is that you present your assessor with a record card of a patient requiring management for suspect glaucoma. So if you present a record card of an open angle glaucoma suspect, which successfully evidences your ability to deal with that situations, you'll get very few questions about open angle glaucoma, and your assessor will concentrate on closed angle glaucoma or narrow angle glaucoma, because you need to make sure you're competent there too. If, however, your fellow pre-reg down the road presents a competent record of a closed angle patient, then they will get a different assessment experience because their questions will be concentrated more around open angle glaucoma. It's very important how you present your record-based evidence to the assessor. And I'm just going to talk through the following format to present both your trainee case discussions or to show your anonymized patient records and patient records to your assessor. So the format that we suggest is that every record should tell a story. It should show what you have heard and asked. It should show what tests you did as a result and what those tests revealed. It should also show how you decided to manage the issue. And very importantly, it should show the advice that you have told the patient. So if you present each record in this way and get used to presenting records in this way, then your assessor will listen to the story of how you have seen your different patients and the advice that you have given them. The assessor can then pick out the key things and details and ask you further questions. And I would strongly recommend that you try and use this format when you're practicing presenting records to your supervisor as well, because that will help with the supervision process. And it will also help you prepare for your assessments. So an example might be this 68-year-old lady presented for an eye examination and noticed blurred vision in her right eye. I found that her visual acuity was 636, improving to a 6.9 with pinhole. Slit lamp examination revealed a moderately dense nuclear sclerosis cataract. On discussion with the patient, it was decided that she would be referred for cataract surgery. I have completed a referral letter and given the patient a patient information leaflet. Patient confidentiality and anonymity. Now this is very, very important as well. So We've said that a lot of the evidence that you present will be record-based, either the records themselves or anonymized records, or the trainee-led case discussions, or the reflective accounts. They're all based on records. So it's vital that you seek consent for all the records that you see, because a college assessor will look at any record as part of the assessment process. So patient consent must be noted on all records. Verbal consent from the patient is sufficient. And you must record in your logbook and on the patient record the name of the person supervising you when you either dispensed or examined this patient. Record-based evidence without consent or anonymized patient records, which are ineffectively anonymized, will not be accepted during your time on the scheme for registration. Again, you're going to be presenting some contact lens records and some dispensing records. You must provide complete records for the assessment process. A complete dispensing record outlines the patient needs and requirements, the advice and the specifics relating to the device ordered. And this level of detail must be noted on the record at the time of the dispense. You will have to sit down with your supervisors or other members of the practice team to make sure that the computerized record system doesn't erase or lose parts of your contact lens records. If you have somebody in your practice who was maybe a trainee a few years ago, they may mention record card templates. These are no longer accepted. And a record must be contemporaneous. So that means that you must write your record at the time of seeing the patient. You mustn't let the patient go and then write down lots of detail afterwards. You must not alter these records at a later date because that would be considered cheating. But what you can do is, as part of your discussion with your assessor, you might say, oh, well, to improve this, this record, I would do this next time, but please do not amend any records. Now, this brings me on to cheating and misconduct. The simple advice is please just don't do it. Unfortunately, every year I see a small number of trainees who've decided to amend or falsify a record to gain advantage. Often, they're very good people who have felt under pressure, financial pressure, family pressure, pressure from their employer, and they've made a bad decision. The problem is, if somebody does cheat or falsify records, it'll be brought to my attention, an investigation will take place, and following that, some of these cases do end up in front of the GOC, and then the pressure will become even worse. If you're having a problem finding a particular patient episode, speak to your supervisor, speak to your assessor. These problems can all be solved, even though at times they're going to really feel quite challenging. During your remote assessments, your assessor will make a note of the records that you used for your anonymized patient records and your trainee case discussions and reflective accounts, and will sample these during your face-to-face visit at visit 3 to make sure that the record does exist and contains all the points that you said you did. So please, again, don't be tempted to tweak things just because you're being assessed remotely. Now, what do you need to do to prepare for visits? So your supervisors will say that the trainees who find the scheme the easiest are those who are the most organised. And you do have to be very organised during your time on the scheme. You have to find and present a lot of evidence. And it's you that's driving this. It's not your supervisor. It's not your assessor. It comes down to you. You are going to be the one who will determine how successful you are on the scheme and how much progress you make on the scheme. The good news is that the scheme is set up to force you to be organised. This does mean there's a great deal of paperwork for you to complete and send to your assessor in advance, but the paperwork is designed to help your assessments flow more smoothly and successfully. The first bit of paperwork that you'll need to fill in is your assessment framework. And these can all be found on the college website in the Scheme for Registration Handbook. So there's a framework for each assessment visit, and the framework will list all the elements that are going to be assessed at that visit and the indicators for each element. Because if you can evidence the indicators, you have proved your competence. It also lists the compulsory evidence you need to present for each element. And where the record card evidence is needed, there is a space for you to fill in with the patient identifier on the record. So you can plan your visit. You are picking the records that you want to use, and you're making your life easier by picking the right records. So it is vital that you think about why am I picking this record? For example, if at visit 2 you're presenting an anonymized patient record of a patient with a headache to evidence element 112, elicits the detail and relevance of any significant symptoms, what you're not trying to do is to prove that you've seen a patient with a headache. What you are trying to do is evidence the indicators. And if you find that your record doesn't evidence the indicators, then don't use it. Use a different one. And think about, well, what other evidence might this record cover? So it might also cover a patient with neurological issues or a patient with BV problems. And if they've got a field defect with their headache, then use the record for that. So all sorts of evidence can come out of one record, and then that record can be used for more than one competency. And then you're saving assessment time, and you're giving an impression of competence because your assessor can see that you've spotted the links. Your supervisor has to complete a supervisor training review score. And this, your scores need to be put onto the framework document. And in your logbook, there's also a tab where you can document when you sat down and had a training review with your supervisor. So when your supervisor agreed to take you on, they agreed to carry out a review with you once a month. And they're going to score you on all the different competencies. And then you'll begin to realize where maybe you need to do a little bit more work. The idea is that you present evidence for enough elements to fill the assessment time. So it doesn't matter which visit they link to in the framework. So you can move competencies forward if you feel that you've gained a lot of experience in that area. There's also a logbook summary. Please send your logbook summary through to the assessor as well 1 week before. Then your assessor will know whether you've had a lot of experience in dispensing and whether your numbers are where we expect them to be. And the purpose of sending everything through to the assessor a week before is, well, A, it gives the assessor some time to prepare. And also it will help the assessor kind of begin to identify your strengths and weaknesses and highlight the level and range of experience that you've had. And gives your supervisor a chance to input into assessment decisions. Then the assessor can plan your visit based on your action plan from your previous visit and the information that you've sent through to them. So what will happen on the assessment day? Now, we realise that many of you will be very anxious when you're having visits, both remote and face-to-face. Stage 1 is a formative assessment. The assessor will talk through the different competencies with you, they'll look at the indicators with you, and they'll guide you through what is required. The assessment for visit 1 and visit 2 will be done using a video sharing app. Some assessors use Zoom, some Microsoft Teams. And it is a good idea if you practice using Zoom or Teams with friends prior to the assessment visit. You'll present your trainee case discussions verbally, as we discussed earlier. Your assessor will already have received from you your reflective accounts and your witness testimonies, as are listed on the framework for each visit, but it will probably be useful for you to have a hard copy in front of you as well. And your assessor will pick certain key points from these and talk them through with you. The assessor will ask you some questions. They might ask you to think of a case scenario of a patient you've seen in the last couple of weeks. And the assessor will also share on the screen some field plots and maybe some prescriptions for the dispensing competencies. So you need to be prepared for all of these. And if you look at the framework documents, they will tell you which the compulsory evidence types are for each competency. Time is tight, so the more organised you are, the more prepared you are, the slicker you can be on the day, the more elements the assessor will have time to assess. And the smaller visit 4 will become, and there's less likelihood that you'll need a visit 5. So I cannot stress enough how important it is to be organised when you have these remote visits. And make sure as well that you're in a quiet space where you won't be disturbed. Now, visit 3 is when the assessor will come and visit you in your practice, and you will have a direct observation using a real presbyopic patient. So this patient you will organise, and it must be somebody that you've not seen before. You're going to be allowed 50 minutes to complete a full eye examination on the presbyopic patient. We're encouraging everybody to carry out indirect ophthalmoscopy. Historically, we've always asked that the presbyopic patient trainee should use a trial frame and lenses. During the COVID pandemic, a phoropter is permitted. Then you will also have organised a simulated patient, which is often a willing staff member, and your assessor will observe you completing direct observation just on one eye, a soft lens fit, a tear film assessment, and contact tonometry. Again, you really must be practicing all these things on a regular basis, and ask your supervisor or one of your additional supervisors to watch you complete these tasks before your visit 3. Then at visit 3, your assessor will look at some of your records, the records listed in the assessment framework, and use images and case scenarios. And they will go back and cross-check some of the anonymised patient records or trainee case discussions that you've used in visit 1 and 2. Now, the contact lens fitting, it is important for me to highlight what constitutes a contact lens fit for evidence purposes. So you need to provide in visit 2 an anonymised patient record of a soft fit and an astigmatic fit, and then we've got the patient record of a presbyopic fit, I think, in visit 3. So for each of these to count as evidence, your record must show that you carried out the information gathering, the selection of the lens based on that information, the initial assessment of the lens on the eye, and sufficient follow-up visits to allow you to issue a full contact lens specification. When the patient comes back for the follow-up visit, this can count towards your end of trial total, which you would record in your logbook. Now, for a contact lens aftercare, these patients need to have worn the lenses. They need to be real patients, and they need to have a refractive correction. And you need a minimum of 20 aftercare records of patients who are established wearers. And an established wearer is somebody who's worn a lens for at least 6 months. Now, if all your aftercares are straightforward and you've not had anybody with a complication, your assessor will show you an image of maybe a soft or an RGP or maybe both complications to investigate your management of complications. It is still compulsory that everybody who is on the scheme for registration and who completes the scheme for registration carries out some hospital iService experience. That is for all community-based trainees. Now, you can do this in two ways. You can complete 10 observational sessions in an NHS hospital, and you should download the college logbook and hospital logbook and take that with you and get those sessions signed off while you're in the hospital. Alternatively, you can complete the college online virtual HES experience. Now that is 9 different modules, because one of them is rather large, and one of the modules is an interactive module. It is up to you to book on to the interactive modules for the HES experience, and they are released at various time points over the year. And then what you have to do is you have to either show your logbook or the 9 certificates that you will gain from the HES experience, and you show those to your stage 1 assessor. You should complete your HES experience while you're still in stage 1. Witness testimonies are also used within the scheme, and you'll find these again on the in the college handbook. And this needs to clearly identify what you've done, what the trainee's done while you're being observed by a witness. Now, again, historically, these used to primarily be used while trainees were carrying out their hospital experience, but we've involved your supervisors much more this year. And there is a series of what we're calling guided witness testimonies. So the guided witness testimonies, they've broken down the different points, the different aspects of a competency. And your supervisor has to sign off that all these different points have been covered and accurately completed. And then your supervisor will initial each point that they've observed you completing. And when you are emailing your witness testimonies to your assessor, please also copy in your witness. Witness testimonies can be used for supplementary evidence for other elements too, and there is a blank template on the college website to use. To be useful, a witness testimony needs to include as much detail as possible, and this one has been put up as a guide. So we're coming towards the end now, and there are a couple more slides about how we strive to make the scheme a fair process for all of you. So if you feel that you need a reasonable adjustment for any reason, amblyopia, dyslexia, or any other disability, you must apply to the college using the link that's shown here and is also available on the college website. I'd recommend to you that you apply as soon as possible so that adjustments can be made for your first assessment if they're needed. We're very aware that some people may need slightly different adjustments for the OSCEs compared to for the work-based assessment, but applying early is key so that your reasonable adjustment application can be given due consideration and then added to your file. Complaints. Now, first of all, please speak to your stage 1 assessor about any concerns. Speak to your supervisor. But then if there's still a problem, then please go to the complaints section of the college website. We want to make sure that the scheme is fair up and down the country. Quality assurance is in place to make sure of this. So as part of this, all assessors and examiners undergo mandatory training. All assessment visits are observed, both at stage 1 and stage 2. And you may find that at some point during your year that you're observed. After your assessor has written the report, which they have to get to you within a week, these reports are looked at on a sample basis to check that they're up to scratch. And a large number of trainees are interviewed each year about their experience within the scheme and about their assessor. So please, if you're contacted and asked, would you be interviewed, you are helping with the quality assurance processes within the scheme. When you get to the OSCEs, OSCE marking is peer reviewed within the OSCEs by the chief examiner or their deputy. And then where required, the marking decisions are moderated by the final assessment panel, who sit about a week or so after the OSCEs are finished. You'll need to be in regular contact with your assessor. Please make sure that all contact is professional. So, when your assessor gets in contact with you initially, they will explain to you the best way to contact them. So that may be by their mobile, through email, and also through post. Please do not send anything registered or recorded delivery to your assessor. They're busy people. Be professional, be prompt in replying to your emails, and remember, for visit presentation, all relevant information must be sent to your assessor at least 1 week before the assessment date. And if you do cancel the assessment visit at short notice, then you will be charged for the visit. So thank you very much, everybody, for listening to me today. There's a lot of information here that I've given you, but you will also find further information on the college website under the Scheme for Registration Handbook 2021. And good luck while you're on the scheme. Thank you.